what I'm trying to have a look at is there any pain around the lateral hip? Now, to find the greater trochanter, what you don't want to do for the painful hip is just get your thumbs and just go crazy and start digging in too deep, because it will irritate what's already irritable hip. Just start to orientate yourself. Hand placement around the iliac crest, hand placement around the greater trochanter, and just locate where that greater trochanter is as a starting point. The reason for accuracy issues is that if you have a patient who has a higher BMI or more fat around the lateral hip, the ability to palpate that greater trochanter accurately is also diminished. Equally, the accuracy and palpation skills and manual palpation skills of clinicians will differ from one person to the other. Now, in certain scenarios where injections are used as therapy, often you would want to try and identify the different facets of the greater trochanter, being aware that the superior or anterior-superior footprint of the glute med passes over that facet and into the lateral facet, with glute med predominantly being a little bit more anterior. However, the difficulty with that is anatomically, we are all very different, and equally trying to palpate and isolate that on a greater trochanter is very, very challenging. And that's why this has a specificity that's quite low, but a sensitivity that is in the mid-80s, depending on the research that you read. But what we're trying to have a look at here is first and foremost location of the site, and then equally at that point, just distinct pressure over the greater trochanter to see if it elicits the pain. If it does, again, it tells us locally that there is something irritable, but it doesn't necessarily help our diagnostic picture other than the fact that we haven't been able to rule it out yet. Now, in this position also, you can palpate soft tissue structures going from the greater trochanter into the glute med, into the glute max and that lateral hip to see if there is any other soft tissue, irritability, hyperactivity, or other kind of scope of areas that we could potentially manage with manual therapy if needed. But predominantly what we're trying to have a look at here is isolation and irritability of symptoms. If we mentioned that the patient had pain more around the iliac crest rather than this region, the same principles of palpation do not differ. We again find that iliac crest location, start to palpate where the insertions are and see if it elicits the pain. But with your handling, you don't want to be digging in. You just want to palpate with the palm of your hand first, find where the location is, and then once you're at that site of where you think it should be, then you can just apply a gentle amount of pressure to see if it elicits the pain. At that point, then we can move on to the further assessment tools.